Exactly. Have they escaped?
Yeah.
Are they still looking for this person?
The other thing I wonder too
Yeah.
is if they're confident that he's isolated into a certain part of the hospital, which is why they're comfortable evacuating and having this stance, is because they maybe at least potentially know where he's at.
In a closet or a stairwell or something like that, right?
That could be a scenario we're looking at too. And again, it's a huge hospital. I'm just looking at some stats from them. They treat 26,000 kids a year.
Wow.
So there are a lot of kids that come in and out of this hospital, not to mention the whole rest of the hospital is obviously still trying to function as well. As you see more of those officers kind of move through there, and it looked like that one almost took off his vest. That's always a good sign.
Yeah.
You know, if they're taking off some of their gear. But lots going on down there for sure.
And this is something we were wondering earlier, Susie. Is this something personal? Did this person come in? Why did he go into the pediatric unit? Was he looking for someone in particular?
Why this
A
hospital?
child,
Yeah.
a mother, a father, and why this hospital, right?
Yeah.
And it looks like there's more people coming through the window there. And to your point with that one, unfortunately, I've covered more than one hospital shooting before in my career.
Yeah.
And you know, the twice that it's happened to me that I've covered it, both times have been personal.
Yeah.
You know, the person has some kind of connection to somebody, either a grievance or something like that. As we see more, it appears almost hospital staff being let out.
Almost escorted out, right, Mike?
Exactly.
Look at the one officer with the long gun and then walking them outside.
So we've been watching a mix of both law enforcement officers and medical personnel, as one was mentioning, coming out of the hospital right now. It's unclear exactly what is going on inside the hospital, but as far as we can tell, this is doesn't feel like a tense situation as it did before. More officers and more medical personnel coming out there, as you can see, escorted by officers. You know, and I wonder, you know, if they are, you know, going floor by floor and just clearing the staff, just to make sure they're, you know, not in harm's way, just in case, just to make sure, you know, just say hang out outside for a little bit while we handle this.
My guess is they're leaving just essential staff there, right, to take care of the patients that are left behind, because not everybody can just walk out of the hospital if you're tethered to a machine or you need medical care. My guess is by thinning out the crowd, maybe it's a lot easier to capture this person if he does somehow give them the slip. And here we have more people being escorted out.
Yeah, and hospitals, you know, and especially a hospital the size of Loma Linda, have plans in place for this kind of scenario of how many people need to remain behind to care for patients, you know, who's critical, who can we get out, and shelter-in-place protocols, rather. That's why the whole Code Silver Alert exists, because unfortunately they've practiced this just in case something like this were to happen. So you know that they've got that plan there as we're looking at more hospital employees kind of walking towards the door.
Yeah. And Mike, you're still waiting to hear back from the hospital, right? They haven't gotten back to you.
The hospital's not said anything to us. They've not posted on social media. They've not responded to our inquiries at all. So yeah, we've not heard anything from Loma Linda.
Gosh, such a large number of people now being escorted out of the hospital, right?
And so we heard from that student earlier. They received a text message, and it was to shelter in place.
Right, and he said that this was not a drill, which makes sense. Mike says that these silver alerts.
Yeah. So I can read you the exact text of it because we have a copy of it. LLUH, Loma Linda University Health, has declared a Code Silver active threat. Then it says report of armed assailant at PEDS Emergency Department, Pediatric Emergency Department. Right. This is not a drill. Initiate immediate protective actions. If confronted with a threat, run, hide, fight. Additional information to follow.
Run, hide, fight. I mean, imagine getting that text on your phone and you're inside the hospital.
And then seeing this police presence, you know. You know, as you can see, it looks like they're just kind of hanging out in the lobby, right? As they get escorted out by a number of law enforcement officers. Looks like they're getting escorted out now. Yeah. But we've been watching this, dozens of staff there at the hospital being escorted out by law enforcement officers, as we believe they are going floor by floor right now and possibly doing a search right now for a possible person with a gun is what started this. As we mentioned, they were reported to be in the pediatric unit wearing a black shirt, black pants, and it's unclear right now if they're still inside the hospital, if they've made contact with this person and they know that. But whatever seems to be happening inside the hospital, we can say that things are more calm at this juncture.
And you can see these people look like potential patients or visitors. They're moving at a much quicker rate than those hospital employees. Those guys are itching to get out of there, which I do not blame them at all. I can only imagine kind of how scary of a situation this is to, you know, be at a hospital somewhere where you think is safe, somewhere where you're there to get help, and all of a sudden you find yourself kind of smack dab in the middle of this, as we really start to see a ton of people kind of start to pour out through here.
And I noticed a lot of the medical personnel, Mike, too, they had what looks like their lunch bags or their backpacks or whatever with them. So they are leaving the hospital for the day. And whether or not they can come back later, I mean, who knows, right? I mean, luckily, as you said, this is something they planned for. This is a code silver. The fact that they told people during the text it was not a drill makes me believe that they have had these drills before where they do practice for situations like this. And sadly, it's coming into play tonight.
Yeah, and Des, we see all these people coming out. I don't know, what do you think maybe we do a loop around and see what the other half of the hospital looks like? I don't know if there's any kind of activity on the other side. I'm just curious to see, you know, what they've got going on over there. Because I know that the emergency department, I think, is kind of on that first floor there. So I'm just curious if they're doing anything over there. And Des, I know their air traffic's difficult up there too.
Okay. Copy. Yes, we will see if we can make an orbit. I'm talking to Dylan. He just told me that the choppers were saying that they're beginning to wrap up.
Oh,
so,
well, that's great news.
You know, whatever was going on here, definitely very, very good news. And in fact, when we first saw the people coming out and some of those sheriff's deputies, I don't know if you saw this, there was a group of them right here that were shaking hands, giving each other hugs, almost like congratulatory.
Okay. All right.
Makes me think that, you know, perhaps this situation has been neutralized one way or another. So, I mean, but so many people coming out of the hospital, there are dozens of people, at least 50 to 100 that we saw coming out, probably, like we said, floor by floor. They still have their helicopters here. We'll see if we're able to, okay, actually they just left, so we'll see if Dylan is able to pick up an orbit around the hospital here. I think there's still one other helicopter here we need to coordinate, so we'll see what the other side looks like. But that's also, you know, more good news, just the fact that if the helicopters are leaving here, that tells you that this is, you know, turning into a static scene. So, you know, perhaps worst case scenario is that they have this person locked down somewhere, or they're confident that they got away, or, you know, whatever else of the threat. I don't want to, you know, confirm that it's been neutralized, but everything that we're starting to see within the last 10 minutes is really starting to kind of point in that direction.
Are any ground units there, Desmond, leaving?
I don't think so. There's, you know, so many of them right here. There's probably going to be a pretty detailed debriefing, you know, where you'll see them kind of huddle up and kind of go over everything that happened. So it'll probably be some time before. Although I say that, and I am starting to see some. Looks like some officers walking back towards their vehicles here, so maybe we will begin to see at least a few of them trickle out as we're on the east side of the hospital. Here's actually a cadre of officers right here that are also walking away, but we are coming around now to the southeast side of the hospital. Haven't seen this since earlier on when we first got on scene. And yes, as we zoom in here, there, I believe it is the emergency department.
Adult emergency.
Just one lone, one lone person down there. Looks like they were opening and closing a gate, but you know, they also have traffic here going eastbound, and you know, if they thought that this was an extremely, still a very serious threat, they probably would not have that traffic open right now. But as we get a complete orbit in here of the campus, and you can see just how large of a facility this is, and the massive, massive response. So still, you know, like I said, these details can come very slowly from the authorities. I'm sure they'll have a press conference about this later, but we are starting to definitely see a much more relaxed attitude from all people involved here at the medical campus, Loma Linda.
All right. Desmond, thank you. And we want to get some feeling from the scene there. We're joined now by Dr. Michelle Paglia. She's inside an adjacent building in Loma Linda. Doctor, can you hear us?
Yeah, I can.
Doctor, thank you so much for joining us. We know you're busy, and we appreciate your time tonight. Tell us about what you know, what you heard, what happened.
Yeah, so just a few minutes after I left the pediatric emergency department, I just got word from my co-residents that they heard that there was like an active shooter in the emergency department. So my co-residents are actually hiding down there under the tables, and quite a few of our residents throughout the floors, they've barricaded the doors until we've gotten word that the scene has been cleared. But for now, everybody is just kind of staying put until we get clearance.
Doctor, have you heard whether or not there has been clearance yet? Well, what's the latest that you've heard from maybe someone that you've been able to text that's a little closer to the pediatric area?
Yeah, so we've actually been just relying on our hospital system for the notifications, and about 15 minutes ago they said that the situation is still not clear, so we're just staying put until we hear back from them.
Doctor, we saw some medical staff leaving the hospital escorted by law enforcement officers. Do you know anything about that, about any other operations that are happening right now?
I have no idea. I'm sorry.
No, that's okay.
And I've got a question regarding this type of alert, and that the text message said specifically this was not a drill. So this is something the hospital obviously has plans for in case they have to do it. It obviously came into play tonight. Is part of the deal when we saw so many people being escorted away from the hospital? My guess is some medical personnel does stay behind to care for the patients that can't perhaps move out of the hospital when something like this happens, right?
Exactly, yes.
So, Dr. Paulia, I guess I want to hear, just speak from your heart to me. You know, you mentioned co-residents, so that means you're also a resident there. This has got to be very frightening.
Yeah.
Yeah, it's definitely terrifying, you know, having people you care about in this situation. So we luckily are all very connected and have been kind of staying in touch over text. So, it's kind of a situation that's still evolving and not really quite processing everything that's happening. It feels a bit unreal.
I mean, those co-residents were talking about how they were hiding and barricading themselves until they get the all clear. What have been some of their texts to you? Have they heard anything? Law enforcement, yelling anything around them? Did they tell
Not really. Yeah, all of it's just been kind of hearsay. So. Yeah,
and Doctor, any clue why the pediatrics unit would be perhaps, in this case, the scene of something like this happening?
Yeah, I have no idea. Yeah.
I guess just
tough,
as a doctor, what's going through your mind right now? Obviously you come to the hospital to help people, and in a situation like this where you feel so helpless.
Yeah, exactly. Yeah, obviously care deeply about, the patients that we serve, but even more so the people I work with on a day-to-day basis. I've seen them sacrifice so much, and it's hard to know that right now, a lot of us are pretty terrified for each other. So it's it's a difficult time.
Doctor, tell us about the pediatric emergency unit, the area that we're talking about. How many patients are in there usually being treated? What's the situation like down there usually? Yeah,
it's a pretty busy ER. We are like a tertiary hospital, meaning that we get multiple patients from, all over, like from 7 different counties. So it's a very busy ER since we have a lot of specialties. So, pretty high turnover. We get a lot of really sick kids. So it's tricky.
So this isn't the NICU, right? This is where somebody would bring their child who might need stitches, or they're dealing with, just not feeling well, or being dehydrated, or having a high fever. Is that the type of patients you see in this unit?
We see, all ages, and kind of from the ER they triage where they're supposed to go, from the NICU to the, pediatric ICU to the wards. So it's kind of the first place that you go before you kind of determine where their next level of care will be.
And talk to us about the entrance to that area. I mean, are there multiple entrances?
Yeah, there are multiple entrances. It's connected to the adult emergency department. And then we also have multiple entrances throughout the hospital as well.
And because it's the emergency room, Doctor, it's on the first floor, right, for easy access when the ambulance comes up or people show up. So it would be an easy way to enter the hospital.
Right, exactly.
And Doctor, what have you been doing since you got the word about what's going on here?
Yeah, so luckily, because I'm in the building, adjacent, we were able to, barricade, the doors and luckily there's a lot of badge access to get here, so I think I'm in a pretty safe area. But
the badge access, I think, is really going to make a difference, right? So that people can't get into certain parts of the hospital. I've seen that where there's the public areas, there are the waiting rooms. Near those waiting rooms, there's security guards. So the badge access was possibly very helpful in keeping this person out of certain areas of the hospital, because this is a large campus, Doctor. I mean, we're seeing it from our helicopter. It is so large. I mean, it would be almost impossible to track somebody down in there.
Mm-hmm. So it's been an interesting time so far. But my phone is dying. My family's calling. I might have to hang up from here.
We appreciate you so much, Dr. Paglia.
Mm-hmm.
Dr. Michelle Paglia joining us tonight. We appreciate you, and we hope for the best.
All right, thank you.
Thanks
Thank
again.
you.
All right, let's go back up to Desmond Shaw and SkyCal. Des, you're seeing a little bit more movement there?
Quite a bit more movement. I'm starting to see a lot of people shuffle back into the hospital right now, and the law enforcement presence is beginning to recede around Loma Linda University Medical Center. Here, more and more people. I've seen dozens of people begin to walk back in, so hopefully returning to some sense of normalcy. I know we all really, really want to know just what exactly transpired here, but we'll be waiting for sheriffs to let us know all that as we see, a squadron here of armed officers coming out just to show you how seriously they took, this whole situation. And this is, maybe not even a fifth of the officers that were in the hospital at one point. So the fact that we just saw them all kind of shuffle out of a side door right there. It looks like they may be getting to be huddling for a debriefing. We've just been, waiting for an official code 4, but unofficially, it's really looking that way here as not just doctors, but looks like visitors making their way back into the hospital. Here's a couple more right here. So, I mean, obviously, if you're visiting the hospital, it's probably a pretty stressful situation as it is, and how much more exponentially so it would have been today. So, and look now, actually here, as just in the last couple of minutes, this is really beginning to thin out as well. I mean, we had like 100 police cars out here. Now we're down to a dozen or so. So really starting to wind down this situation, it looks like, tonight in the Inland Empire.
And Mike, any idea why the all clear is taking so long to be declared?
Yeah, no. So we're waiting for San Bernardino Sheriff to give us that information. I've just emailed them again. Loma Linda finally is saying something on their social media. Unfortunately, it's not much, only saying that law enforcement has responded to our campus. It's an active investigation, and that all media inquiries should be directed to the sheriff's office, which we have done. So, but I wholeheartedly agree with Desmond. The fact that they're letting people come in and out of the hospital, the law enforcement presence is thinning out significantly. I would say whatever the threat was, at least at this point, appears to be concluded. Whether or not that's because they have somebody in custody, whether or not that's because this whole thing didn't end up being what everyone thought it was, we have no idea. Law enforcement, I just asked San Bernardino Sheriff again if they can give us the all clear or at least some kind of update on what's going on, because obviously something has shifted where they're no longer going hospital or room by room in the hospital. They are now kind of just letting people mill about and business as usual as they start to clear themselves out.
But, it seems like, two different things happening right now. Outside of the hospital, we see the thinning of the law enforcement officers. But inside the hospital, as Dr. Paglia, who we were just speaking with, who's in an adjacent building, was just talking about, her co-residents are still inside this building right now. And they've been texting her. And at last check, this was 15 minutes ago, that she was saying they had still not received that all clear. And they were hiding and barricading themselves inside a room still. So it looks like, as Mike was talking about, as Juan was referring to, this is taking a little while. And you can imagine, if they are going floor by floor, room by room, and they are really, with a fine-tooth comb, I'm sure, going through this hospital right now. And that's what they needed to do. So, any work, it's not going to be fast.
Right. Mike, could the possibility be that this was a false alarm, a false alert?
It definitely could be. We've seen that before. I will say, just from experience of dealing with these things before, this law enforcement response was a lot for something, if it, because sometimes you'll get these reports of a person with a gun and they'll respond in force. But the way they responded in this situation makes me feel like that somebody official had eyes on this person or definitively, kind of knew that this person existed versus, some citizen or some visitor to the hospital making a report. Usually this kind of level of response leads me to the theory that somebody had a really good set of eyes on this person, whether or not they were able to quickly detain him and then wanted to make sure that there was nobody else with him. Sure. And that's what this long search was about, or what exactly happened there. But I would just say, based on the level of response, there was probably a pretty credible, report of this person. Whether or not he ended up being as dangerous as everyone thought, but they minced no words calling it an armed assailant.
Sure.
And again, it's on the first floor. This person could have come in.
Right.
And gone out. By the time that law enforcement arrived, he was long gone.
Right, and I have a source who actually worked at the pediatric, he doesn't anymore, but a pediatric nurse there at Loma Linda. The emergency department, yes, is on the first floor, but the children's hospital itself is multiple floors. So the ED is on the first floor, which is where they said this was happening, but if that person is staying within the children's hospital, he could have gone up to different floors, and that could have been what took so long. Also, if this person's carrying a duffel bag, they're going to want to sweep the building to make sure he didn't leave any surprises behind at all. And give me 1 second. I'm getting an update from my colleague, so I'm going to send it back to you guys.
All right. Susie, the last time I went to a hospital and I was bringing in a backpack, I had to go through metal detectors.
Sure.
The bag had to go through an X-ray machine, almost like I was going through to the airport, and I had to show my driver's license, and they printed out a visitor's badge with my face on it as well. So they really do, these hospitals really do a great job at making sure that if you're there to see somebody, that you're allowed to be there, that you're there on official business.
And it makes you wonder, how that person did actually come into the hospital. We want to welcome our viewers now to KCAL News at 8, alongside Juan Fernandez, Mike Rogers on the desk, Desmond Shaw live in SkyCal, and meteorologist Danny Roberti. Good evening, everyone. I'm Susie Sa. Our top story tonight, this breaking news, people headed back into the hospital now at Loma Linda University Medical Center after a report of a man with a gun. Let's go to Mike Rogers at the desk now with an update for us.
Yeah, and I wanted to get this to you guys. My colleague Orlando, we're getting another one of those alerts from a person that works at the hospital, and I want to just read it to you here. Code Silver update, all clear. Law enforcement has completed their investigation and confirmed that there is no active threat on the campus. Normal operations may now resume. We will share additional details as they become available in coordination with law enforcement. We thank you for your cooperation during this time. So they are saying right now there is no active threat, but the interesting piece of that information is they want to coordinate with law enforcement before they release additional details, which leads me to think that there, in fact, was some threat at some point, and they're going to work with law enforcement to tell everybody what that is. But at this moment, the all clear has been given.
And you already told us the hospital referred us to law enforcement, so definitely they're going to be the ones to give us the very latest information on what happened here at Loma Linda Medical Center. Again, reports of a man possibly with some sort of gun going into the pediatric units and then disappearing, and then, of course, this incredible amount of law enforcement that we're seeing there. All right, we're going to continue here with more news tonight because, of course, our other top story, we're now just hours away from heavy rain, low-level mountain snow as well, and the coldest temperatures, Susie, of the season.
From the Palisades to Altadena, we are on storm watch tonight, and our live team coverage begins now with KCAL News meteorologist Danny Roberti. Danny.
Yeah, hi Susie, hi Juan. I'm going to be walking you through what's happening right now. We've got meteorologist Evelyn Taft here as well. We're going to be talking about where the storm is going, how it's moving. Let's jump right to it. As Susie and Juan mentioned, we are just hours away from heavy rain and